So let me just start with an introduction. My name is Stephanie Schell. I'm the Managing Director of Strategy Development for Public Health Management Corporation, and I am the Executive Director of the Pennsylvania Public Health Association. And you are all with us today because you're part of My Vaccine Counts, which is our HRSA-funded initiatives to build vaccine confidence across Pennsylvania, Delaware through strengthening of the community health worker workforce in both states. And we're just beyond excited to have you with us today. And we have a really, really big agenda. So we planned a really cool icebreaker, and then we realized would take the full hour to go through it with you all. So we're not going to do that, but what we're going to try and do is do it in a little bit of a virtual way. So as I'm about to share the agenda, what I would love to do is ask each of you to use the chat to introduce yourself. If you could put your name, your organization, and the one word about if you tomorrow were going to run out and get the pet of your choice. What pet would you select? So your name, your organization, and the pet that you're going to run out tomorrow and go get. So while you all are doing that in the chat, I'm going to share my screen. Actually, I think, Simon, you're going to share your screen, right? And we're going to talk through the agenda really quickly before we dive into the content today. And actually, maybe I'll share my screen. Let me just get it going. Okay, so hopefully everybody can see the screen, and I'm going to just take a quick moment to run through the agenda with you all. So we're going to start with some introductions, and I'll introduce a couple members of our team next, and then we're going to reveal our website and our toolkit. This is going to be a hub of information for you all and for our communities across Pennsylvania and Delaware. We're then going to turn things over to one of our core partners, the National Nurse Care Consortium, who will talk through our training approach. We'll then be reviewing some of the data collection and reporting procedures that we'll be using in partnership with our colleagues from our research and evaluation group here at PHMC. We'll then be talking about reporting and invoicing. And finally, we'll hope to have a few minutes to answer your questions and hear your thoughts. We have a lot to go over today, so I already know we're not going to be able to have time for all the questions that you're going to have. So I really encourage you to use the chat as we're talking. Put your questions, your comments in there, and we will start working on an FAQ for you all so that we're sharing back responses and information as we go. So I want to just take a second and introduce a few colleagues who are on with us right now. Stacy Pundock, who probably most of you have had the opportunity to communicate with, if not in person, at least via email. Stacy is our project coordinator for My Vaccine Counts. We also have Simon Caskey with us today, who's our project assistant. And these are the two people that are really going to be helping you with all the nuts and bolts with your work related to this project. And I think, as many of you know, we have a lot of really strong partnerships that are going to make this happen, including with all of you. But I just want to call out a couple of our really core partners who help both develop the proposal and who are leading this work with us. So first and foremost is my colleague Tim Gibbs from Delaware, who is the executive director of the Delaware Public Health Association. So Tim, we're so happy to have you with us here today. And then we also have our friends and our colleagues from Latino Connection, including George Fernandez, who's the CEO. And we'll be sharing more about what they're going to be doing, but they're going to be doing a mobile tour across Pennsylvania and Delaware and really doing a lot of support with vaccine events and clinics. So welcome again to everybody, and thanks for putting all your information in the chat. And we're gonna start to dive in. So I'm gonna start with going over, or at least showing you the website that we have developed for this project.
All right, I got to get into my meeting, Sabrina. I love you. And
Kelsey, can you mute? Thank you. We'll try and keep everybody muted. But hopefully everybody can see the screen. So we're happy to share with you today the website that we have developed to keep us all informed and coordinated. It's called My Vaccine Counts, and the website is myvaccinecounts.org. We're not going to go through it all with you today, but would encourage you to take a look, explore it a little bit, and give us feedback, because this is just the beginning. We're building this website as we're doing the work, and so there's a lot of content we need to add. And what you'll see is that this is really designed with sort of two options. One, if you're just a community member who wants to learn more about COVID-19 or vaccine, you sort of enter from the right. And for all of you, most of what you're going to be looking for as community health workers and as organizational partners and subcontractors, you're going to be entering from the left, where it says, I'm a community health worker or part of an organization. So if you click on that box, what you'll see is several bubbles that will have lots of information. Again, we're really still building this out, so there'll be more content added over time. But what we want you to pay particular attention to is the last bubble on the right, which says trainings and COVID-19 vaccine toolkits. If you click on that, it takes you to the spot where you can download our toolkit. And where you can also register for training. So again, we're going to be talking lots more about this, but I really wanted to encourage you to take a look when you have a chance. And with that, I also want to briefly, I know I'm talking really quickly, but please make sure to put stuff in the chat if you have questions. I want to show you our toolkit as well. So, which I have to find, here we go. Okay, so we have a toolkit that we just posted online a couple of hours ago, and this will be the toolkit that you all will be using as you go out into your community with the people that you're working with to encourage them to consider receiving the COVID vaccination and receiving boosters. So I'm just showing you right now the table of contents because I want to make sure that everybody understands how this is all organized. So what you'll see is the first section is just going to be information, facts about COVID-19 and facts about COVID-19 vaccinations. And it's all structured so that it's like questions and answers, and I'll show you that in a second. The second section is the section that I think you all will probably want to take a really close look at, and it's going to be information about building confidence in populations around vaccination. So this is really where we have some of our core messaging around vaccine confidence. And then the third section, we dive more deeply into some of the diverse audiences and populations that we know many of you will be focusing on in your work. We know this is not not a perfect list. It's not, it's again, a work in progress. We really want to hear from you as you're engaging different audiences as to how we build this out further. So we've started with what we know. We've started with populations that we know are under-vaccinated in Pennsylvania and Delaware, but we know we've missed a lot too. And so again, your feedback, your participation is going to be really important to us as we work to make this better and better. And then we come to the last section, which is sort of more generic information about connecting to primary care and strategies to reduce the impact of COVID-19 on your health, on your community, and sort of some general information on isolation and quarantine. So again, this is structured. We tried to keep this structured as simply as possible. The information is very simple and I hope very clear. And everything is structured so that it's question and answer. So our hope is, as you are starting to talk with people and work with people, and as they start asking you questions, you're going to be sort of able to pair their questions back with the toolkit and see the responses there that we're recommending you consider using with the people that you're working with. So again, I don't want to go into this in too much detail, but did want to make sure you understood how it was organized. I think what I'm going to do is just take a breath for a second and see if anyone has any questions so far. The toolkit, the website.
So would we be required to, hi everybody, sorry I'm late.
No worries, hey Marcia.
Crazy busy office. Will we be required to print those out to utilize for our clients, Stephanie?
So you are not required to print them out. I think, we're certainly hoping to support all of you and your organizations in making sure you have access to this resource electronically. That said, if you would find printouts of this helpful, we will make sure you have printouts. So
Okay.
we want to know what you need, and we want to be able to give you what you need. So if you need printouts, if you need electronic resources, please speak up, please keep us informed, and we will work with you to make sure you have what you need. Great. Any other questions before I turn things over to my colleagues from NNCC? Okay, great. And feel free to use the chat. So Kelsa and Deepa, love to turn it over to you guys to talk about our approach to training.
All right, thanks, Stephanie. Hi, everyone. My name is Deepa. I'm a Director of Public Health Programs at the National Nurse-Led Care Consortium. And just a little bit about who we are. We are a nonprofit member-supported organization, and our mission is to advance nurse-led healthcare through policy, consultation, and programs that reduce health disparities and meet people's wellness needs. We are headquartered in Philadelphia, although we are a national organization, and we are an affiliate of Public Health Management Corporation. So as Stephanie had just reviewed in that website, My Vaccine Counts, I don't know if we're able to pull that up again.
Sorry, Deepa, did you want me to share? Or did you?
Yes, sorry about that.
You want me to share the
Yeah, can you go to the website screen, and then if you're able to go to that page you were just on that talked about the trainings.
Okay, I'm on it. Hold on.
Thank you. Okay, perfect. So yes, so like we were saying, so we are an affiliate of Public Health Management Corporation, and NNCC is going to be offering a free online training program for community health workers at your organizations to learn strategies, tools, and resources to advance health equity, and particularly thinking about lessons learned from the ongoing COVID pandemic as well. Now, our training is going to help satisfy the educational component within the requirements by the Pennsylvania Certification Board. So upon completing our training program, and then also completing some of the other requirements, I believe there's supervisory hours that are required, and some other components that are also needed to be met in order to get the certification. But by going through our course, your community health workers can at least check off that they have that educational component completed. So our certification program will be addressing 8 core competencies, which is required by the Pennsylvania Certification Board. And so this will include things like community health concepts, advocacy, capacity building, care coordination, health literacy and education, safety and self-care, cultural competency, and much more. And we are adding an additional component to equip community health workers to speak on relevant COVID information. Now, our program is going to span 17 weeks. And it'll, provide community health workers with the skills to care coordinate successfully. And again, want to reiterate that this will be sort of leading you in the direction to becoming a certified community health worker. Now, we strongly encourage that attendance takes place during the virtual trainings on Zoom, but we do want to also let you know that all of our sessions will be recorded and posted in our learning management system called Bridge, so that it's available for access at later times. So we do understand, people have busy schedules, and we will make these trainings available. And then if their community health workers are accessing it in Bridge, it can be more of a self-paced course that would happen on their own time. And then what other things do we have here? So we are looking to actually launch the beginning of our trainings next Thursday, March 3rd. So all of the information about the trainings and more would be covered in our first session, which will be the introduction to the course and syllabus review. Now, just want to share that this is open for community health workers across Pennsylvania and Delaware. The sessions will be taking place every Tuesday and Thursday at 2 and it's going on from March through June. I'm looking in the chat. The sessions will vary in length, but I think, Kelsey, correct me if I'm wrong, but the sessions, are they typically 2 hours?
Yeah, so each session will range depending on which training module we're actually conducting during that session. They typically range between 1.5 hours to up to 3 hours. And then we are also offering specific training like CPR and first aid, mental health, first aid training, Narcan training. So some of those more specific trainings where we have external organizations and partners come in to speak and train, those will also be a little bit longer. But typically the time span for each session is approximately 2 hours.
Thanks, Kelsey. And yeah, so on our website, you can check out more about the trainings. We also have linked our certification guide, so you can see more about the curriculum there. And registration is open on the website, so please check out the page and encourage the community health workers to register today. And I'll take a look in the chat and see some of the questions that we have coming in.
I can also chime in a little bit. I'm seeing a lot of questions on whether or not this training is required and if folks already have that certification, if they need to still go through this course. By no means is this training curriculum a requirement within the HRSA grant. This is simply our way to advocate for the professional development of your community health workers and our workforce. So this is just something that NNCC would like to provide to our workforce and to enhance community engagement practices. So I would recommend, if your folks aren't certified, maybe getting in touch with them and seeing if they're interested. But yes, this is not a requirement by any means.
Any other questions around the trainings? And feel free to continue adding to the chat, or you can also feel free to unmute yourselves as well.
Deepa, I believe there's questions regarding if the community health worker has already completed CHW training in another state. Like, what's the process for that? So there's one from John and Erin here.
So the program plan that we have right now, this will put you in the path to becoming a certified CHW in Pennsylvania. If you are, so it's sort of just like an added bonus of being part of this program. Now, like Kelsey was saying, if you're already a certified CHW in Pennsylvania, that's amazing. That's great. What you could do is take a look at our course load, and if there are any sort of topics there of interest that weren't covered in the courses that you've taken in your certification course, you can choose to opt in and participate in that as more of like a professional development based on your interests. But again, I want to reiterate, none of these are required trainings. It's more, we are offering this as a sort of added incentive for providing support for community health workers. And then if there's that interest in going on to become certified, you're already partially there by completing this educational course. And the same for Erin, I'm just reading, same for the Delaware community health workers. If you've completed some sponsored community health worker trainings in Delaware, it's not a requirement to complete our training courses, but think of it more as, here's an additional resource. There are free trainings available on a variety of different topics that can increase skills for community health workers. So think of it more as, here are some courses available. Take a look, see if there's anything that would be of interest to the staff that they haven't had an opportunity to be trained upon yet. And they're definitely, welcome to join in that way as well, but it's not a requirement. If you're not interested in pursuing the community health worker certification, then it's not a requirement to do every single course, but we do encourage, just taking a look and seeing what fits best for your needs.
I also just wanted to reiterate as well, if folks aren't interested in becoming certified, but they would like to attend specific trainings, we can absolutely accommodate that. So feel free to just reach out to your folks, seeing if all of our agenda is listed online as well, and it shows what kind of trainings we're recommending, what trainings we're offering. So if your folks just want to attend like 2 of the 33 different trainings we're offering, they're more than welcome to attend. And then we should also be able to provide access to our learning management system for everyone who's interested. I'm also just going to place in the chat box here really quick, if there's any other questions that you would like to reach out about, that's my email address. Feel free to reach me at any time, and I'm happy to answer additional questions.
That's great. Thank you guys so much. And again, I know, as we continue, people will have more questions. So keep putting them in the chat, keep speaking up. We're all sort of building this together as we're doing it. So we appreciate it. And with that, I'm going to turn things over to my colleague Kelly Fayan, who's going to talk through the data collection and reporting procedures we'll be using. And there's a lot of detail here, so we're going to just take it slow and move through it, and speak up if you need us to go more slowly, or if you need more, as you have questions. So Kelly, I'm going to go ahead and share my screen, and if you want to unmute.
Thank you, Stephanie. This is the most exciting material you'll hear on the call, I'm sure. So thank you for your time and attention. HRSA does have some required reporting. And basically for the evaluation, where we will show, hopefully, your impact, the impact of community health work on motivating people to get vaccinated and boosted, we have to complete, meaning your CHWs and other outreach staff who are part of this grant, 4 main surveys for HRSA. HRSA created them. They are on SurveyMonkey. And my evaluation team and I are holding information sessions about these 4 surveys. And I'm going to ask, after this call, in the next day or so, you'll receive an email with times for you to sign up your staff, which you're not required to. I highly recommend that you have some of your staff or someone you designate talk with me about these survey forms. And I'm going to just give you a summary of them right now, and we'll supply you with the forms. And in a couple of weeks, excuse me, you'll be receiving your staff, rather, the CHWs, or other outreach staff working on this grant will receive a tote bag with some materials as sort of a backup and kind of our goodwill gesture, because we know that hopefully they'll like the tote bags and find them useful. They're really pretty. I'm very pleased with the design, and but hopefully we will be clear and communicative with you as much as possible in how to complete these forms, because basically there is one form for the community health worker who never has to see it again once completed. It's just a one-time only form about the community health worker's characteristics. Some personal questions are on there because the federal government would like to know across the country a little bit about the community health worker workforce, and eventually to do some research about how, if any of those characteristics might be kind of related to the success of the project or the vaccinations that were successfully achieved. So, and please keep in mind, by participating in these surveys, I genuinely think that you're going to get credit for your work on what's called a general outreach and education survey. Can you please advance the slide for the next slide, Stephanie? You'll be getting, we want to give you credit for where credit's due. So the time slots that you'll receive in an email within the next day or so, please, again, sign up some of your staff or who you think is appropriate. And then my colleagues and I will have a one-on-one session. We are going to record one of them and make that recording available, but I think that there's a really good opportunity for your staff to talk with us directly. In addition to those information sessions, we'll be holding office hours, and I'm going to show you that schedule in a few minutes. Part of the challenge in filling out these 4 surveys is that the community health worker has to put in an anonymous ID, the same ID throughout the entire experience for the next several months. That person should get an ID from you. So I essentially need you or one of your coordinators to issue the community health workers an ID. And I will explain this again in a summary email, but essentially I have assigned, there's a formula that we need to use for each of your organizations when you create the community health workers ID number. And that ID number allows the information that goes directly to HRSA. The community health worker is going to send survey data directly to HRSA. I don't even get to see it at that point until later when I get anonymous or de-identified data back. It is all confidential and private. That's why HRSA has set things up this way, where your staff are entering SurveyMonkey data directly into the system. So the biggest challenge in completing these forms starts with having this community health worker identification number. So I'm going to communicate with you outside of this call, but this slide, and please don't advance, but you'll see the next slide is community-based organizations L through Z. I have created the structure that your IDs need to follow, which all IDs, and this is again how HRSA has required the setup, all IDs from all of you will start with PHMC for your community health worker. And then there's going to be a 5-character part of the ID that's or like an abbreviation of your organization. And then the final 5 digits of your community health workers identification number will be the number that you or one of your designees sets for your staff. So the first person, her ID ends in a 1. The next person's ID ends in a 2 and a 3, and so forth. So I have a template you can use, an Excel spreadsheet to create and issue the IDs. I would do it for you, but I don't know who your community health workers are or how many people will be providing outreach on the project. However, this is something we can also discuss on the individualized information sessions. You'll be receiving this in an email, the ID that I'm giving you to your organization. Can you please advance to the next slide? So this is just another example of, if you see your name, Living for Tomorrow, for example, your ID, your community health worker ID will start with PHMC LIVTM 00001 and the next person 02. I'll check that question or comment in just a second. And there may be some things that aren't quite right, and I recognize that maybe I didn't when I tried to fit everything on this slide, I couldn't get all of your full name sometimes on the slide. Looks a little different here, but so I apologize if the name that you see here is abbreviated. But I just really wanted you to know that we need a system. We have to establish a system for your community health worker to have an ID for your community health worker. And then it gets a little more complicated, because with one of the forms that HRSA is asking that you use under certain circumstances, the community health worker needs to create an ID for the community member getting the vaccine. And I'll get to that in a second. Can you advance the slide, please? So again, 4 tools from HRSA. The first can be eliminated immediately once the community health worker completes the survey. It's called the Community Outreach Worker Profile. It's 30 questions. It takes about 15 minutes. And once your community health workers have their own ID, you're going to have the links momentarily to these electronic surveys. And we ask that person take the survey and then never has to see it again. Once that survey is out of the way, we really are only talking about 3 bits of paperwork for this part of the evaluation that your community health workers are really being required to complete where possible and under certain circumstances. And by that, I mean there's a general outreach and education form that I'll walk through in the information session with your staff. Those are 13 questions. You may have a similar form and how you collect your own outreach activities, information about them and descriptions. But this form, HRSA is basically asking a little bit about the activity. Was there an event? About how many people attended? It's meant to be a summary form. It's not meant to be completed with every interaction a community health worker has. It's going to be challenging. The the third item I've listed is, in my opinion, the most important form. It's the vaccine site form. It's got 7 questions for the community health worker, a little bit like the date of, this is under, if someone is at a vaccine site. So, you know, you wouldn't complete this form if this isn't how you conduct your outreach activities. However, if you're at a vaccine site and the vaccine recipient has been talking with the community health worker and you feel like, you know, this is part of what your community health worker has done and has successfully built goodwill with this individual, hopefully your community health worker will complete this form, which asks a few questions about the general outreach and then a few questions for the community member himself or herself, because the government would like to know a little bit about people who are getting vaccines as a result of talking to community health workers. If we'll go on at the information session a little in greater detail, of course, about the interaction between the community health worker and the vaccine recipient, and maybe some brainstorming about how, you know, if someone doesn't want to answer the questions, you move on. There are actually options on these survey forms for I prefer not to answer. And if ultimately, as a last resort, that can be a way of answering them. And finally, I'll get to the questions in just a second, but the booster form is the final form. And so all of that's the shortest form. And we'll walk through, you'll get paper copies of these as a nuclear option backup. Although these forms are really, they need to be completed directly into the HRSA's SurveyMonkey system. Can you go through to the next slide, please? And I'm almost finished. I know that this is a bitter pill to swallow. I recognize it can be challenging, but once people get used to completing some of these tools, it gets much easier. Half the battle is getting familiar with the ID. And so this is just a slide of a flyer that I created and you'll receive momentarily if you haven't already. It's a 1-page flyer back to back that has the survey links, but also has QR codes. If a community health worker has a tablet or a smartphone, some of your organizations are providing those or built that into the budget of your grants, which I'm really thrilled to hear, because that's the best way and the optimal and really the ultimate way of getting the data to HRSA. Can you advance to the next slide? So I did mention that my colleagues and I will be holding, in addition to these upcoming information sessions for your community health workers, we will also be offering office hours. We'll continue them throughout the duration of the grant, but I want to revisit come April, see how they've been going. Are they useful? Are people calling into them? Because if they're not really useful, we won't keep holding those office hours, or maybe we end up rescheduling a different time. But for now, you will be receiving this via email so that you have the link. It's a link to a Zoom meeting room for every Monday, starting next week. Going forward, once you have the tools and the information, and you can even come to the office hours next Monday having just read a paper version of those surveys and you've got questions. So that I invite you to feel free to come to the Monday Zoom session. You know, it might be helter-skelter because everybody has their own issues and their own questions, but we'll do our best to address your questions. You can also feel free to email me. I'm Kelly Fian. My colleague, she's not on this call, but her name, Etta, is available also by phone and email. I will take just a second to look at
She don't want to be with you no more.
I'll take.
She don't want to be here no more.
Kelsa, can you mute? Oh, thank you.
I'm just going to quickly go through a couple of the questions. Yes, the booster form is just like the vaccine site form. And you know what? If you don't really know that it's a booster until you're halfway through the process, you just fill out the vaccine site form. Those are the kinds of things that I can talk to you about on the office hour call. There is not really specific guidance yet from HRSA about some of the nuances to these issues. So we're going to create, or what I want to do and intend to do, is create an annotated guide, or I guess kind of an FAQ sheet, so that some of the nuances or commonly, some of these questions can be ironed out. When in doubt, you would fill in a vaccine form if you're with someone and they're getting a vaccine. But again, you need the ID as the community health worker in order to do that, and you're assigning an ID number to the community member. So I'm going to be asking that people make a list in a notepad. I'll actually be putting the notepad in a tote bag that you'll get once we have them in our hands. We'll be shipping them out to you. But you are going to need to keep a list of IDs that you create for other people. And again, I have more notes about this and longer slideshow, so I will provide you with that information. But this was meant to be an introduction into the beautiful, beautiful world of evaluation. I may have missed some of the questions. There's no, I have to think about the public health information, the private information that's in the surveys. There are there's the questions that are most personal, ask age, race, gender, and maybe there are a couple questions on the community health worker profile that are personal, that about their own, do you own your own home and is it in the same community where you're working? And they ask about wages for the community health worker. They want to figure out what the average wage is around the country for the community health worker. So I think I didn't make the questions, as I said, but I think there's a reason for some of those questions. We all have our preferences about which questions could have been eliminated. But if somebody feels uncomfortable completing those, there are ways of skipping the question or clicking I prefer not to respond. But to my knowledge, the most personal questions are about age, race, gender, off the top of my head. I think there's a sexual orientation question. And again, I'll be talking about these. I'll be showing you or your staff the actual surveys together. There's Spanish, just to get through one final question, and then I'll read these. I'll read your questions. Some people are writing to me even privately, so I have to go through them when my colleague speaks next, and then I'll try to respond to you. Unfortunately, the short answer is the SurveyMonkey system is not yet in Spanish, but there are plans for HRSA to unfurl that soon. And we do have a booster form on paper in Spanish if you'd like to have that, just as a place to start. We have some other information in Spanish, but unfortunately, the SurveyMonkey tool is only in English for now. Thank you so much for your time. I really appreciate it. And I know this is the least interesting and exciting portion of the call, so I tip my hat to you.
I have a question. I think it has, and bear with me because I'm coming off of a contract with Temple University and I don't want to confuse it with this contract, but just wanted to make sure that it's clear. When we take, and you'll probably do this in the training, but when we take on a participant and the participant, let's say the participant does the vaccine, and then maybe we don't get them to do both vaccines. We get them and then ready for their second vaccine. Will we be able to sign them up with this, even though we didn't do the initial vaccine?
Yes.
Okay.
Yes. Yeah.
And then,
and go ahead. I'm sorry.
Go ahead. Go ahead.
I think it's going to be too difficult to remember the same person over time. So I know I'm being recorded, but my advice here is that people, you might, if you know that you're with someone, let's say tomorrow your community health worker fills out a vaccine form because she and somebody, this person got the vaccine after talking with her for the afternoon. She would fill out that vaccine form with and for that person. And then 5 months later, she meets the same person again who wants a booster. I would just submit it as a new record. Okay. There's no way your community health worker is going to be able to keep track of the ID number for the person she met today. You know what I mean? And so if if that's the advice that I'm giving to people right now, because it's very unwieldy to establish an ID system to keep track of the same individuals. I'm sure that the researchers at HRSA would welcome being able to track the same individuals over time, but I think that it's a lot to ask of your workforce. So so I would just fill out a new vaccine form 5 months from now if I met the same person again, because I'm barely going to remember that I met them. I've been, talking to 1,000 people. And so I don't know if that completely answers your question, Marcia, but
It did.
Okay.
That was very much on point. So
Okay,
thank
good.
you. I appreciate that.
Thank you. And I know that some organizations have worked with Temple. We are following the rule that HRSA asked us to, but Temp, in terms of how to enter the data and get it to HRSA, Temple's been a wonderful partner in this and shared a lot of good information with us. And so I'm going to model the information session off of something Temple did. Thank you.
That's great, Kelly. Thank you so much. And I know there's still more questions we haven't answered, but again, we will be developing an FAQ, and what we haven't been able to answer today, we'll get back to you all in writing. And I know we do probably need to move on just in the interest of time. So Stacy, you want to start talking about invoicing and progress reporting? I'm guessing people are also curious about the subcontracting process and what the timeline looks like with that.
Yeah, of course. So first of all, I just want to say that I invited one of our wonderful contracts coordinator, Erica Rooney, onto the call. So if you have any questions, please feel free to add them in the chat, and I'm hoping she might be able to help answer some of those questions as well. So yes, I want to talk about the HRSA required monthly invoicing and progress reporting. So you are required to complete both a monthly invoice and a progress report at the same time. And that will be due on the second Friday of the month. So again, at the same time. For right now, I'm going to have everyone submit those invoices and progress reports to me via my email. So again, we'll send these slides at the end of the chat, so you'll have my email address. And I'll address the invoicing requirements on the following slides once we get there. So Stephanie, if you actually want to advance the next slide, we can do that. So I know a lot of you guys have came from the Temple grants. So our monthly progress reports are very similar to the Temple ones. So after we get off the call, I'll be sending you this report, and you'll just be filling this out every month. So in our first section, this is the updates on our key activities. So in this area is where you can write your activities and outcomes. So for example, if you held X amount of clinics and X amount of individuals were vaccinated. So that's something you could put in there. The second portion would be where you would put your top successes. So this could be successes in hiring strategies or workflow improvements, etc. Then below that section, we have our challenges section. If there is any challenges, you can report them here, how you plan to mitigate these difficulties or strategies that you plan to mitigate these difficulties. And then the last one is your administrative and expenditure updates. So this is where you'll be reporting if there's any staffing changements or budget changements for that month. So Stephanie, if you could please get to the next slide. So this is a template of an example of the invoicing. So per HRSA, there is no required specific document to submit. So you can just use whatever your organization uses to submit invoices. However, the key point here is to just be very specific and detail oriented when you're submitting these invoices. These invoices are per hour increments or quarter hour increments. That's what it is. And they just have to be very specific, and then there needs to be an invoice number, and the address that it's coming from has to be the exact same as the one from the W-9s that you're submitting. So Stephanie, if you could please go to the next one. This is also just another example of invoicing for travels and mileage reimbursements. So again, these aren't required to submit these exact forms, but if you want, I can send them after, but just feel free to submit whatever your organization uses for invoices. And then if you want to hit the next one, Stephanie. So yeah, I just wanted to open it up to any questions that anyone has.
Hi, I do. Excuse me, this is Stephanie Booker, and we were one of the recipients on the HRSA grant through Temple University. And I know Shirley had taken her time out and set up the invoices where they have formulas in there. So it comes out with what we were approved for, and then you put in one column what you spent, and then you keep following on the month. Then it has a balance of what your remaining funds are. So when you go to the following month, you add the first month and then the second month together to one column, and it'll tell you what you have in your remaining balance. And it keeps everybody on the same path. Is there any way you can create that document? Because it's a little easier to follow once you understand what's going on. Because I made a few mistakes the first month, but Shirley sat me down and we were able to go through it. But it definitely keeps a track of the funding and you know what's available, what's not available, and it keeps people a little more straight and narrow than trying to go back and reference different invoices every month. Does that make sense?
No, it does. It makes great sense.
I can work on setting up a template that does that for you.
Thank you.
And
And
I
I
think
don't
I'm
know
sure-
how to do it, but I know how to put the numbers in the boxes.
Yeah, I think Shirley's been so generous with everything she's. I'm sure she'll share their formulas and their templates.
Yes. It's
Stephanie,
very
thank you so
convenient.
much, and we'll
You're welcome.
Simon will follow up on that, and we'll make sure we borrow yet again from Temple, who has been so.
Thank you.
Yeah, we've been in like really good touch with Shirley, so I'm sure she'd be more than happy to like send the exact type of thing.
And if you like, I will send you a copy over of our last invoice. Yeah, I know the formulas are still there.
Sure, that'd be great.
Okay,
Thank you.
you're welcome.
So I'm just getting a couple of questions. Can you clarify the quarter increments? Because we applied for so. Sorry, there's a lot of questions coming in right now.
When you're talking about money, it gets real.
I knew this was going to be the portion where we're going to have a lot of questions. So
Yeah, here, Stacy, why don't I start sharing the questions, and then we'll see who's best to respond. So I know there was one question about whether or not the invoice would be electronic. So I'm not really sure. Erica, I don't know if you know if that's possible. Certainly we can look. Erica, you have a sense?
Yeah. So what I think the idea will be, once the template of the invoice is developed, then you guys can submit the invoices electronically to Stacy until further instructions on to whom to submit them. But yes, they can be submitted electronically. However, I'm not sure how the template will look, but if it does require signatures, just keep that in mind. If you do submit a Excel spreadsheet, that is acceptable for our system, but if it requires a signature, then you guys will have to develop that on your side.
That's great. Thank you, Erica. So, and stay tuned because we'll look into that a little further and make sure, again, we'll try and do this in the way that's easiest for everybody. The next question is from Katie. And Katie, I think I understand your question, but I might ask for a little clarification. So the question is, if you have a full-time community health worker, can you bill for all of their work hours in a month, or is it limited to specific activities given that it rounds to the nearest quarter hour? So I think you have to make the best call you can make about whether or not their activities can be tied back to this work, right? So if you have a community health worker who's going to a health fair at Penn State.
Don't keep doing that.
Pardon, Marcia? Oh, sorry. And you can, and they're talking about a million different things, but one of them is COVID vaccine confidence. I would tie that back to this work. If they're going to something that's really specific to diabetes management and there's really no room or space or, way to tie that back to COVID related work, it's going to be hard to justify the hours. So, I personally think that a lot of the work that CHWs are doing right now, that I think COVID's part of all of it, but but I think you all better what your folks are doing. So anyone from our team want to add anything to that? Hopefully I answered that, and Katie, hopefully I answered that well enough. If not, speak up. Okay. So I'm going to pass this one to you, Stacy, for the progress report. This is from my friend Lisa. For the progress report, how would you like states and counties separated?
That's a good question. I feel like you can add them all in that same section, but just maybe do, by counties for that state. I don't think it has to be too specific.
Okay, next one. Can you clarify from Sue? Can you clarify the quarterly increments because we applied for salaries and not hourly wages?
That was a question I literally wrote down too. I think this would be a great one for you, Erica.
So it's basically an estimate, right? Like the same way is quarterly increments. Yes, that's what our contract says, but make it to your best of your abilities. We usually do have salaries, but we still have a hourly rate that we use to determine that salary. So that's what you will base yourself to. It doesn't have to be to the penny, but it is like if a person is making $15,000 a year, which I hope it's more than that. But if someone is making $15,000 a year, you can deduct that into a salary, an hourly wage, and that's what you will be billing us for, invoicing us for. Does that answer your question?
Yeah, and I think that, Erica, I don't want to speak for you, but I would assume that Erica and others on her team and our team would be available to help with those formulas if you need help. So if you're not sure how to sort of figure that quarterly increment out, just let us know and we'll help you make it work.
Definitely. We're always here for any support that you guys need.
So there's no third-party system that we have to enter into. So we send it directly to you. Does the report come with the invoice? Is it required to submit the invoice?
Yeah, so they'll just be submitted at the same time. So that monthly progress report and the invoicing one, just put it together in one email and you'll just send it over to me. Like I said, for now, I'm sure we're going to come up with a better method to submit electronically, but just for right now, while we're really just getting it off the ground, just send it to me via email.
Okay. And Stacy, just for GP, let me address the elephant in the room. What's the turnaround time? So we're doing, we're reporting a month's worth of activities, and let's say we're all starting in March. We submit March's invoice April when, and then what is the turnaround for payment?
So let me take that one. So so the monthly report and the invoices have to be submitted together. So if you submit an invoice, we don't have your monthly report, it's going to be, we're not going to process that invoice till we have the report. They're due by the second Friday of the following month, but obviously the sooner you get it in, the more quickly we're going to be able to turn it around. So you do not need to wait for the second Friday. And we are working with our fiscal team to get a specific turnaround time that they're going to commit to. What we've asked is that they be able to turn around payments to, as much as possible within 30 days. And, probably prioritizing those of you who are sort of smaller organizations, smaller budgets for like quicker turnaround time. But, we're going to try and get everybody in this 30-day window. So I'm still waiting for a firm commitment on that, and we'll communicate that as quickly as we can. And we want to, again, this is another thing we need to hear from you on. If that doesn't work, I know you all have cash flows issues you have to be concerned about on your end. We have cash flow issues on our end too. We also have to be attentive to, and so we're trying to strike a balance that gets you what you need and gets you the money in your hands as quickly as possible, but that also doesn't compromise our financial stability. So aiming for 30 days. So stay tuned. So I hope
I appreciate that. Yes, Stephanie. Especially, I think once the flow starts, the most difficult month will be the first month when we've got to buy those tablets and then get the training in and the meetings in with our team. That'll probably be the most painful 30 days. But once we get into a flow of things, I'm sure that it'll get a little easier for us.
Yeah, and we don't want you to be in pain. We don't want this to be in pain. So if you have a particular circumstance or a particular situation that you're worried about, please reach out to Stacy and let us work with you on it.
Okay, thank you so much.
I don't see other questions in the chat unless I think others were addressed in the chat, but did we miss anything anybody asked? No. Oh, wow. So we still have 5 minutes left. Now
Hold on.
we've done like the real act.
No, people are asking me questions, so let me, and they've.
Oh, go ahead, Kelly.
Kelly, this is Janae Samuels Ford from Turning the Tide. I'm
Oh,
sorry, just I have
please.
one quick question. Oh, excuse me. For Stephanie, I did ask a question about the purchase orders or / contract numbers. It was either for Stephanie or Erica. When we could expect those for the invoices, which.
Yeah, so let me share what I know, and then I'm gonna ask Stacy to weigh in on one thing. So we're in the process of finalizing all your scopes of work and getting them to Erica, who's going to be processing the subcontract. So I think we'll have all the scopes of work into Erica by the end of this week. And then Erica, I don't know if you have a sense of when then we would be able to turn back the subcontracts to everybody.
So my expectation is that me and my team will have the contracts out to everybody no later than the second week in March. I just wanted to let everybody know that we will be requiring certain documentation, such as a completed W-9, direct deposit form. If you guys want to receive your payments via direct deposit, that will need a voided check, proof of the insurance, and it's a brief questionnaire that we ask all our subcontractors or vendors or partners to fill out. We send all our documents via DocuSign. What I'm going to do is coordinate with Stacy, so when the contracts are getting ready to be sent out via DocuSigns, she sends an email to all of you, so you're in the lookout for those contracts. And if you don't receive it, then you can just definitely reach out to me or one of my team members, and we'll be able to reissue and work with you guys in how to get them signed as soon as possible. We will not be able to issue payment until a fully conformed contract is received. So let's get it done.
But I think there's also then another question there that about like the unique identifier, so you can start doing the data. Am I right? Am I understanding your question right, Najima?
Well, no, the unique identifier, I think Kelly addressed that. And
Okay, I just want to make sure.
We're not even concerned about the unique identifier for each person who receives a vaccine or a booster. So my question is, the timeline, it seems to be an incongruency regarding the timeline of when Stacy indicated the reports would be due, the status reports for those who have started work already, and when we get the contract. So the status report has to have a purchase order or a contract number that's due before we get our contract. According to Erica's timeline, those contracts may not be received until the middle of March, but our reports are due before then. So do we not put a contract number? Do we not put an identifier?
Yeah, so I think most people haven't started work yet. If you have already dived into some activities, I think you're in a little bit of a unique situation, Najima. So let me and you talk about that and figure something out that will work for your particular circumstance. Because I think most people are starting March 1st, so not in the same situation. So let's just have an offline conversation about that.
Okay, sounds good. All right.
Perfect. Other questions? I know we have like 1 minute left, and we'll have a lot more to share. Great. Well, Stacey, let me turn it back to you to say goodbye. And
so I just want to reiterate that I am your main point of contact. I'm here for, your support, any questions that you have. So if you have any questions, please feel free to contact me. This is my email address. So yeah. And we will also be, like I said, we're recording this and we'll be sending you all our forms, a recording of this, the slides, and a Q&A afterwards. So yeah, looking forward to working with you guys.
yeah, and we so appreciate everyone being with us today. And again, the more, just keep in touch, reach out to us. We're in this together. We're building this together. So the more we communicate, the better it's going to be. And again, thanks to everybody who's already done so much incredible work on this. So
Thanks for the opportunity.
again soon.
Bye.
Bye.
Bye.